Okay, so this is anatomy and 201. Once more, you are welcome. My name is Fam Ezaya. Ezaya is my surname. Is that clear? Yes, I am. Then Anambra State. Chetana Emmanuel. This is my full name. But you can simply call me Fam Chetana. You can simply call me what? Fam Chetana. I'm okay with this. You know this long, but it's good to know this for official things. Yes. So call me by my native name, Fam Chetana. I'm okay with that. Is that clear? So now the course is ANA 201. As I said, anatomy is not new to you. You did anatomy and physiology in your when you did your diploma, right? Yes. Your RCHP, right? Good. So anatomy is no longer new. So you have already laid the foundation there for you to have did first year, second year, third year, and wrote your CACASL exam and passed and entered this your degree program. And anatomy is not longer, should not be a new course to you. So today is more of introducing the course, and we'll look at the outline, outline what you expected to cover in the course. Is that clear? So that's what we are going to do today. So tell others that lecture has started. No time to delay. So make sure that they chat me so I can add them in the groups. Is that clear? All right. So I forgot to come out with a marker because all these markers, I like coming out with my own. So we look at the course contents. Is that clear? So that's what we're going to look at. Please, I want to ask you for. I want to beg you for something. You know, this thing is this exam is centralized. You say, man, all the centers are writing this exam. This is not all the BSc community health nationwide, anywhere they are writing this examination. So what it means is that whatever we are giving you here, sit down to understand, listen to our lectures, understand it, but go and digest this. I didn't say read, I said digest this. Very important. Very important. So whatever we are doing here is to help you, guide you, make you understand the concept. For the concept. So don't abandon this and go and read only what you did here. No. So what we are doing is to lay the foundation. So without wasting time, we'll go into let's look at the course outline. Let's look at what you will cover in this course and take it off from there. Okay, now the first topic. The first topic in this course is descriptive terms and general organization of the words, body systems. Can you see the body here? Huh? Descriptive words, terms and what? General organization of the what? Body what? System. Descriptive terms and general organization of the what? Body system. So what under this topic? We'll look at introduction of the course ANA 201. And the course title is actually Anatomy of the Upper and Lower Limb. So we look at it, we introduce the course itself. So introduction to what? The upper and the what? Lower limbs. See the upper limb, right? Lower limb, right? So they're not new to you. Then after that now, under this same topic again, we look at the descriptive terms used in anatomy. The terms we use to describe different parts of the body. So with descriptive terms used in what? Anatomy. Proximal, distal, lateral, superior, inferior, and what have you. Then, under this again, we also look at planes, body plane. We look at the planes, different planes, and we look at the planes and terms of relationship of the what? Human body. And we also look at in general, we look at the organization of the what? Human body systems. So we look at the organization of what? Human body system. So these are what we are going to cover under this topic. Descriptive terms and general organization of what? Body system. The second topic we are going to look at is osteology. You don't put in anything? Yeah? Okay. We look at osteology. We look at what? Osteology and principles of what? Kinesiology. Osteology and principles of kinesiology. We look at osteology and what? Principles of what? Kinesiology. And under this topic, we have an overview, introduction to osteology. Under this topic, we introduce osteology, what osteology is. This is why it should be at the end. We look at what osteology is. Is that clear? We look at what osteology is. Then, the second thing we are going to look at under this topic is that we look at the study of bones in the upper limb. We'll study the bones. Remember, this course is what? Upper limb and lower limb. So, remember, osteology talks about what? Study of bones. Is that clear? So, we study the bones in the upper limbs. Then after that, now we look at the principles of kinesiology. Then after that, now we'll look at the types of muscles. We'll also look at what? Types of what? Muscles. We look at what? I'm explaining what you're going to look at under osteology. We look at types of muscles. Then we also look at the attachment of muscles in the upper limb. You know how muscles are attached and where they are attached in the upper limb. You know, these muscles, they are attached to different parts of the what? Bones in the upper limb. Is that clear? So that's what we're going to look at in the second topic. Then the third topic under this course, is movement of joints and general organization of what? Body systems. Movement of joints and general organization of body system. Movement of what? Joint and what? General organizations of what? Body system. Movement of joints and the general organization of what? Body system. That's the third topic. Under this topic, we'll look at overview of joint movements. We'll look at what? Overview of what? Joint movements. And we also study the joints in the upper limbs. See joint here, see joint here, see joint here. This joint is what?
The clavicle joint.
Which joint is this? This one called wrist joint, elbow joint. Here is what? Don't worry, we'll look at them, okay? So we'll study the joint in the what? Upper limb. Then we also look at the general organization of what? Body systems in upper limb. We'll review it again. Then, the fourth topic under this course is cutaneous innervation and applied anatomy of nerves in the upper limb. Cutaneous innervation. Anytime you hear cutaneous, we talk about the skin, superficial. Is that clear? So we look at what? Cutaneous what? Innervation and applied anatomy of nerves in the what? Upper limb. Whenever you hear innervation, it talks about what? Nerve supply. Is that clear? To the muscles and what have you, the structures in the upper limb. So cutaneous innervation and applied anatomy of nerves in the what? Upper limb. That's the fourth topic. So under this topic, we will introduce cutaneous innervation. Introduction to what? Cutaneous innervation. We will introduce cutaneous innervation. Talk about what cutaneous innervation is all about. Then we'll now go deep into the cutaneous innervation of the upper limb. We then go deep into the what? Cutaneous innervation of the what? Upper limb. Is that clear? Yes. Then after that now, we also look at the applied anatomy.
Under it, so another topic.
Under the fourth topic. If I enter any new topic, I'll write on the board here. Is that clear? Then I will explain. Then you can put down as I explain what you cover under the topic. Is that clear?
Applied anatomy.
Look at the applied anatomy of nerves in the upper limb. Applied anatomy of nerves in the upper limb. Then the next topic 5, is, can you see here? The next topic is pectoral region and breast. Pectoral region and what? And breast. Pectoral region and breast. Where is the pectoral region? Yeah, touch it.
I think it's this side.
Good. Here or here is the pectoral region. That's where the breast is. Is that clear? Pectoral. So that's the next topic. Pectoral region and the what? Breast. Then under this now we look at the anatomy of the pectoral region. Under this stand, we look at the anatomy of pectoral region. We also look at the structure and functions of the breast. We look at the structure and functions of the breast. We also look at the clinical relevance of the breast and common conditions. So we look at the clinical relevance and common conditions. That's why we now start talking about breast cancer. Is that clear? Good. Another clinical conditions that are associated with what? Breast. You should get note too, you know.
I didn't bring I have a note.
Where is your notes?
I left them in the clinic.
Why?
No, I didn't. They called my attention, so I'm the matron there.
Where?
So I have Sui Hospital.
Okay.
So I just branched by I forgot it in my office.
Okay. Now, the sixth topic is the axilla. Axilla and the lymphatic drainage of the upper limb. Axilla, number 6. Axilla and the lymphatic drainage of the upper limb. Axilla and lymphatic drainage of the what? Upper limb. So under this now, when you say axilla, where is axilla? Touch upper, let me see. Yeah, what are you doing? Touch it. Where is axilla?
This as the size.
You don't know where I see it here. Axilla is here. This channel from the pectoral to the upper to the arm. This place is your axilla. This area, your armpit, and this side. This is
This region.
yeah, this is your axilla. Is that clear? Good. Now I say axilla and lymphatic drainage of the what? Upper limb. Now we'll look at the anatomy of the axilla. Then we also look at the structure and functions of lymphatic drainage in the upper limb. Structure and functions of the lymphatic drainage in the upper limb. Structure and functions of lymphatic drainage in where? Upper limb. Is that clear? Then we look at the clinical relevance and common conditions. That is applied anatomy. Is that clear? Clinical relevance and common condition associated with that region. Then the 7th topic is shoulder region and the arm. Shoulder region. Shoulder what? Region. And what? The arm. Is that clear? Have you seen have you seen how we are going now?
Yeah.
From here we are going. Axilla, pectoral, axilla, shoulder, and arm. Is that clear? Good. Shoulder region and what? Arm. So under this topic, we look at the anatomy of the shoulder region. We look at the what? Anatomy of the what? Shoulder region. Then we also look at the structure and functions of the arm. Structure and function of the arm. Then we also look at the clinical relevance and common condition. Each of these regions, we look at their clinical relevance and what? Common condition. Then the topic 8 for this course. Have you seen? We have a lot to read and cover. Is that clear? So I am only, putting on your this thing, so you know that we have a lot to read and prepare your mind, and we have a lot to study. So you take whatever we are doing seriously, so we can cover this thing. And at the same time, as you go home, you read, so we can cover this thing. Remember, this is not just about passing the exam.
The knowledge game.
It's the practice. The skills you have is what we take you to places. It is not the exam you passed. The exam you passed will only get you that job.
They come and defend us.
Then you come. Simple anatomy, the person don't even know. And you say that you want to, some will go and say that they are doing, they are assisting surgeons. Well, they don't even know anatomy of the part of the body, the muscle that pass through this place. They don't even know the name. They don't even know the innervation. So this is a very serious thing. It's not just about passing the what? The examination. Good. So now, I said that the next topic is what? Okay, I've not mentioned it, right? Topic 8. Topic 8 is cubital fossa, flexor compartment of the upper forearm and the hand. Cubital fossa, flexor compartment of forearm and what? Hand. Cubital fossa, flexor compartment of forearm and what? Hand. What is flexion? Flexor. Extension.
Flexion is like this.
Flexion is what?
No, extension is like this.
Flexion is what?
Flexion is like this.
Is the rest of like this?
Like this.
What of supination? Don't worry, we'll get there. I'm asking because you have done anatomy, so that's why I'm asking you this question. We'll get there. Now, so if they say cubital fossa, where is the cubital fossa?
This.
Where?
I think
See
this
it
is
here.
this
This triangular is in here. This is the cubital fossa.
The left flex.
This is the flexor. This is flexor extension. So here is the flexor compartment. This place that is facing up like this is the flexor compartment. Then this is the cubital fossa. So flexor compartment of the forearm is here. Hand is what? Here. Is that clear? So that's what you're going to look at under this topic. So we'll look at under this now, we'll look at the anatomy of the what? Cubital fossa.
Flexor compartment.
So under the topic now, we'll look at the anatomy of the what? Cubital fossa. We'll look at the anatomy of the cubital fossa. We'll also look at the structure and function of the flexor compartment of the forearm. Structure and function of the flexor compartment of the forearm. Then we also look at the anatomy of the hand. We also look at the anatomy of the hand. Then we also look at the clinical relevance and common condition. We also look at the clinical relevance and common what? Conditions. So that's what you are going to look at under this topic 8. After this now we go to topic 9. Topic 9 is extensor compartment of forearm, extensor compartment of the forearm, and venous drainage of the upper limb. Extensor compartment of the forearm and venous drainage of the upper limb. Extensor compartment of the forearm and venous drainage of the upper. Extensor compartment of the forearm of the this marker is not writing well. So we will look at the extensor compartment of the forearm and venous drainage of the upper limb. And venous drainage of the upper limb. Extensor compartment of the forearm and venous drainage of the upper limb. So under this topic, we'll look at, of course, extensor is the extensor compartment of the forearm. Exactly. Extension is this. Exactly. This is the extensor compartment. This is the flexor compartment. Am I communicating? Good. So now, so under this topic, we'll look at anatomy of the extensor compartment of the forearm. We'll look at the anatomy of the extensor compartment of the forearm. Then we look at the clinical relevance and common conditions. Then the 10th topic. The 10th topic is applied anatomy. So this venous what? Of the what? Of the what? So topic 10. Yes.
Anatomy of the extension compartment.
Yeah, we are done with that one. Topic 10.
Applied anatomy.
Good. Applied anatomy of blood supply to the upper limb. Applied anatomy of blood supply to the upper limb.
Of the upper limb.
Yes. Anatomy. Sorry, applied what? Applied anatomy.
Of blood supply of the upper limb.
Applied anatomy of blood supply. Of blood supply to the what? To the upper limb. Is that clear? Apply anatomy of what? Blood supply to the upper limb. So under this topic, we look at we introduce blood supply. We look at what is blood supply and how is blood supply to the upper limb. How the blood is supplied up. So we look at it. We introduce it. Then after that, now we study the arteries in the upper limb. After that, we study the what?
Under it, right?
Yes. We study the arteries in the what? Upper limb. We also study the veins. So we talk about all the arteries. We name all the arteries in the upper limb. We look at their names and what they pierce, what they supply. The muscle they pierce and what they supply, everything there. So that's what we're going to look at. Then we also look at the clinical relevance and common conditions. The 11th topic under this course is cutaneous innervation and applied anatomy of nerves in the lower limb. Remember this cutaneous innervation and applied anatomy of nerves in the lower limb. Remember the topic is what? The course is what? Anatomy of the upper limb and what? Good. So now we look at the topic 11. We look at the cutaneous innervation and applied anatomy of nerves in the lower limb. Cutaneous innervation and applied anatomy of the nerves in the lower limb. There's one major nerve. Let me tease you a bit. There's one major nerve in lower limb that if there's any problem there, almost all the.
So we paralyze.
Well, what's the name of the nerve?
Is it not this?
Say it.
Sciatic nerve.
Spell it.
S-I. Abe Naim.
Sciatic nerve. S-C-A-I-T. S-C-I-A-T-I-A-T-I-C. Sciatic nerve. All right, let's go.
I just tried it, but not this stuff.
Huh?
I'm not too strong.
Sorry. So under this topic,
Under this one.
yeah, we'll look at the cutaneous innervation of the lower limb. Then we also look at the applied anatomy of the nerves in the upper in the lower limb. Then in general we look at the clinical what relevance and common conditions again. Then number 12, topic 12 for this course. Under topic 12, we look at the femoral triangle and abductor canal. Number 12, look at what? Yeah, femoral triangle and abductor canal. Look at the femoral triangle and the abductor canal. Look at all the structures that pass through the place and everything. So under this topic, we look at the anatomy of the femoral triangle. We look at the anatomy of the femoral triangle. We also look at the structure and functions of the abductor canal. We look at the anatomy of the femoral triangle. We look at the structure and functions of the abductor canal. Then we also look at the clinical relevance and common conditions. So these are the things we are going to look at under the course. Anatomy of the upper and the lower limb. Huh? Yes, so this will show you that you have a lot to study. But don't fear, just make sure you study that one. Make sure that every day you study, don't waste time. Make sure that let the only thing that is keeping you, at least your work, program yourself well, so you can, so you'll be able to cover, study at the same time, work, balance the two of them. Very important. So that is what we are going to look at under this course. Remember, today's thing is just introduction, so we are not doing much today. Just to introduce the course, run everything, and take it off from there. So let's look at, if you hear upper limb is a region of the body, right?
Yes.
So upper limb is not something that is difficult to locate. Your upper limb is here. This is your upper limb. Starting from here. This is your, not here alone. From here, pectoral region, pectoral girdle region. Because girdle, you just say pectoral region, the arm, even though yes, if you, the main upper limb is here, but the attachment, good appendages is here. That's where you have your girdles. In fact, you start from the girdle, pectoral girdle, then the arm. So the arm, forearm, the hand. The hand. Just say the arm, the girdle, the arm, forearm, and the hand. It's when you now start going to the bones. That's when you start going deep into that. You start looking at the clavicle, scapula, sternum, good, but just clavicle, scapula. You talk about the what? The humerus, right? Then talk about radius and what? Ulna. Then you now go to the carpal bones, or carpals. There are 8 of them. You now go to meta what? Carpals. You now come down to what? Phalanges. Is that clear? So it's nothing new to you. Yes, I like the way you are talking about them. That's good. So it's nothing new, right? So these are the regions, areas we find in the what? Upper limb. Remember, we are talking about the upper limbs for now. Now, of course, lower limb. Where do you start from? How many ghettos do we have?
We have 2 ghettos.
What are they?
The
Petula ghettos and pelvic.
pelvic ghetto.
Then you now have your what?
Your femur. Your long bone.
Where is your leg?
The leg is from here.
From where?
No. Here is the leg.
Where's your leg? Touch it, let me see. Yeah.
Here is the leg.
Touch it again.
I don't know.
Here's your leg. Here
Here is the leg. The longest.
He ankle. What is this place called? From here to here is the lower limb, though.
Yes.
From here down is lower limb.
We have the femur, the tibia. Okay, the thigh. This one is the
Don't-
thigh. This one is the
Thigh.
thigh. This one is the leg. This one
Is what?
is the toe. The foot. This one is
Foot now.
This one is the foot. Where here is the
No, just leave that. Just like the way you have hand. Hand covers everything. Say foot cover everything there.
everything. This one is the thigh. This one is the leg.
So it's now when you now start going deep, you now talk about the. Yes, of course, fingers is also there. Fingers and toes. Yeah, I agree. Then you have to talk about the ghettos. Then we have their what? The what is the bone here?
Femur.
Femur. After the femur, what next?
Tibia and fibula.
Tibia and what? Fibula. Then what again?
The carpal's bone.
Carpal.
No, the ankle.
The bone there is what?
Which one? This one.
The bone there is what? Tarsal, equivalent to carpal.
Tarsal. Then we have metatarsa.
And what?
The appendages.
Good. Is that clear?
Yes.
So these are the regions.
Oh, my brain don't come back.
Yeah? Is that right?
My brain don't come back.
Okay, it's coming back now.
Like, don't come. I never get myself. It never come back.
Don't worry.
Travel before.
Don't worry.
Then this guy didn't come yesterday. I haven't chatted him.
So this is a way of introduction, okay? So these things that you are not new to them. Thank God, it makes it easier for us to do what? Understand. So in your next class, we'll now go deep to the main topic, the first topic of it.
Nutrition.
Yeah.
Yes, and general medicine.
But don't wait. Study. Study. You have the course material, right?
I have it.
You have it? Good.
I have
Study.
all of them.
Study. I have opened up this, so go and study. Cover a lot of them. In fact, cover as many as possible.
Thank God I didn't go in.
Cover as many as possible you can.
I am not disturbing you if I ask questions.
No, feel free. Just drop it. You can drop it for you can you can go personal if you want, but I like it to be dropped so that others.
And the same thing, some people will say Obasabi.
Okay, feel free. I understand. You can feel free. You can. I know what you're saying. I understand.
I know the reason I say it.
But it's good for them now.
Because even the iconic group, I'm the class rep general. So there's something that I came up, so I have to investigate and call one of the lecturers. He told me, I put up a book. One was saying, who can contact me put up a book? Then God for some person that I attack
The person.
the three of them.
But to me personally, don't mind. There are still people that want to learn. Don't look into all those things.
So
Unless the question is a personal thing that you don't want. But if it's what anybody can benefit, post it in the group, no problem. Is that clear? No problem. Post it in the group. Then if it's something personal, you can.
No problem.
Those.
At least it's even good because it makes people to learn faster and
So even if I don't attend to it immediately, once I'll just put it, tag me in the group. Once I see the tag, then I will attend to that. Is that clear? All right, thank you very much. Any question?
For the now, no.
All right, thank you very much. See you next time. God bless you.